Hey guys, welcome to Well Chat.
Hey, don't start with me. Oh, wait. Ow!
What's wrong with you?
I got a pain in my butt. It's going down my leg. It's sciatica.
Who told you that?
My leg. It's sciatica.
Who told you that?
Google doctor.
Google doctor.
Yes,
So you looked it up online?
I did. It goes down my leg. It's
Okay.
a pain in my butt.
So they gave you a list of things.
Yeah.
It could be this, this, or this, or this, and you picked out sciatica.
Yeah,
Okay.
sounds right.
Ah, are you sure?
I mean, a lot of people say they have sciatica, so I just assumed.
I know, a lot of people say they have sciatica, but not all the pains that go down our leg into the hiney. Maybe you're from sciatica.
Maybe we need a roadmap. Do you think we need a roadmap?
Maybe so.
We're going to teach you today about dermatomes, and that's our roadmap. Way back when, before we used our phones for everything and got
Yeah.
that forward turtle neck
Yeah.
posture,
Right.
we actually had maps that we would pull open, and we would sit there and examine what's the best way to get from point A to point B, right?
Right.
Well, we actually have something like that for our bodies, and it's something for our nerves. It's called dermatomes, and we've got a chart up here that we want to make sure that you guys can see. Okay, guys, so here's this roadmap. This is the roadmap for our nerves. This kind of gives us a general idea. There's dermatomes. This is what this one's called, and myotomes. We're not going to get into all of that. But sciatic nerve, let's talk very specifically about sciatic nerve. Sciatic nerve is going to originate in the nerve roots of L4, and you can see that right here. L5, these are the dark blues. S1, look how it comes down the buttock and the back of the leg, and S2. Now, every now and then, L4 and L5, you can see, also comes to the front. So every now and then, when we have sciatic nerve pain, it might come around to the front. Generally speaking, we talk about the back of the leg as being a primary distribution for that sciatic nerve pain.
So, our nerves are like a highway. And in order to get to our final destination, we have to have specific routes. So, we need to use a roadmap to get to the final destination.
Which is what we're going to show them with the dermatome, right?
Yeah.
It's really important, you guys, that you seek out the experts in these fields, okay? Dermatomes it wasn't overnight that we learned it. Most of you don't learn how to read a map overnight, and we had to get a lot of training in this. So it's really important that you seek out a good physical therapist to actually give you the
Not
good
a
evaluation.
Google doctor, Sarah.
Oh, come on. Google doctor works for everything, right? I might have, anything, according to Google doctor.
Yes. Well, we are trained in figuring out where those roots go. And so make sure that you talk to a PT about your pain if you've got things that are radiating down your legs or down your arms, because that's where our expertise lies.
And some things that so let's go back to the highway, and that you were talking about how our nerves are like highways. If a highway, so let's say we're going down to Austin, because everybody knows Austin gets traffic jams like crazy, right?
Oh my gosh, I've been there with you many times.
Yes, and it gets to be where it's bumper to bumper, literally when you're with me, right? It's bumper to bumper traffic, and it's very slow paced, right?
Totally keeps us from where we're trying to go.
So let's say our destination was San Antonio. So from Dallas to San Antonio, we hit Austin, and boom, it's slow traffic all of a sudden.
And it's creating a lot of pain.
It literally,
Yeah.
pain.
Literally pain.
You become a pain in my butt
Yeah,
at that time,
and I got
right?
pain going down my legs, and I've got to get out and stretch.
Yes.
But yeah, pain because you can't get where you need to go on time.
So that's like a nerve. Okay,
Yes.
so let's say it goes from 2 lanes to 4 lanes, and then it's really fast, right? And then from 4 lanes down back to 2 lanes, what happens? It gets backed up, right? Because you've got 4 lanes worth of cars trying to merge into 2 lanes.
Or there's potholes in the way, and you got to slow your car down to get around the potholes. Or construction.
Construction's another big one.
Yeah, we know every road is torn up, and for years. So our
Our
nerves are a lot alike the highway and road construction and blocks if we have muscles that are too tight.
So muscles that are too tight, another thing that can happen is the nerves actually go through a canal. So just like if we were on that 4-lane highway and they were supposed to go through something this big, and then now all of a sudden it's this big, it's tiny, even maybe this big, and that's called stenosis.
Right.
So, or there might be rocks, like the potholes in the middle of that, okay?
touching the cars and it slows that down, or it causes more pain to your car,
Or
it
the
busts the
jerkiness,
tire.
right?
Yeah. Same thing happens in our bodies. If the muscle's too tight, it's going to cut that signal off. So that car or that nerve can't get its signal to its final destination. And so what happens? We end up with muscle weakness.
Muscle weakness in the area where the sciatic nerve would have gone.
So say it was at L4 and Sarah showed you on the chart earlier, it went to the side of the leg, or L5, to the other side of the leg, or the front of the thigh, below the knee. If you have pain there, then that tells us that you have something going on. There's a traffic jam somewhere, and it's our job to figure out where that traffic jam is.
And it may be sciatic nerve problems, but it also may not be sciatic nerve problems. So
Yeah.
that's where the trained individual comes in.
Right.
But today on our well chat, what we wanted to give you guys is a couple of exercises. There was 2 exercises and then a modality that they can utilize for very general sake if they're having any of those kind of symptoms, right?
A lot of times when you have symptoms for sciatica, you're going to feel like, I got a pain in my butt. It's like there's a hot poker on it. I've heard that lots of times.
Yes.
Some of you guys sit on a wallet, and that wallet pushes you right in that piriformis muscle. I know you've heard piriformis. Well, your sciatica or your sciatic nerve pierces that muscle in 80% of the population, and the other 20% it goes right underneath that muscle. So if that muscle is getting compressed,
If that nerve is coming into that muscle right here and it's getting compressed, that muscle becomes tight and compressed, then it's going to come down on the nerve like that.
yeah. And so when it comes down on that nerve and it's squishing it, blood flow can't bathe the nerve. And so you're going to get signals down that to the muscle that's saying, oh, I hurt. You're going to have to do something different. So we get up and move. We get up and move so that we can increase blood flow. If we increase blood flow, we decrease pain.
We've talked about before, pain is our friend, guys. We hate it. It's a catch-22. We absolutely hate it, but it really tells us there's something else going on, and it would lead you to seek the experts in the field to figure out what's really going on.
That's right. So if you did truly have sciatica, like Dr. Google said you had,
Google doctor.
Google doctor, then you're going to have pain maybe in those 4 dermatomes we talked about. So it might just start out in your hiney and then work its way in the back of your thigh. And then it might go all the way down to your calf. So the further away you feel that traffic jam,
The worse it is.
the worse it is. The more tightness you have and the longer you've had it. And guess what? It's going to take a little bit longer to get rid of it. You're going to have to work a little bit harder. But for most people who have pain that radiates in that direction down the leg, there's some general things that we can do to help alleviate those symptoms.
And it's important if you guys if you do have pain literally in the rear, okay, or if you feel like you have knee pain and you can't figure out what it is, you've done some knee things, or calf and you can't really figure out what it is, go get it checked out, because like she said, the further along that you let it be, the longer it's going to take to rehab. So if we can catch it at the forefront, then we can obviously help the situation, and it will progress a lot faster than if you just wait, because I know a lot of us don't like to go to the doctor until it's terrible. This is not one of those times where you need to allow that to happen.
And the other thing is there's some red flags that Google doctor might not ask you, or you might not think to ask Google doctor, Dr. Google. So that's really why you need to get these things checked out for sure with your therapist or your doctor.
Today we're going to show them first the piriformis stretch.
Yes.
And I think a lot of them out there think that they are doing the piriformis stretch, so we want to make sure they're doing it correctly, right?
Yes, because there's 2 different directions we want to stretch that muscle, because it rotates one way and it rotates the other way. So I want to break away here and show you the anatomy, what those muscles look like deep in your hip, and then I'm going to show. Yeah, we'll come back and I'll show you the stretch with Sarah, and then we'll show you another exercise. It's called a nerve glide, where we really bathe the nerve and floss that nerve through that tissue.
Literally, like you have floss on your teeth and you're moving it back and forth. You're doing that with a nerve,
and it's super good for nerve pain. So let's break away and look at the anatomy first. So here we see lit up the piriformis muscle, and it's running from the sacrum over to the femoral head. And you can see that big, thick yellow nerve. It's the biggest nerve in the body. That's the sciatic nerve. And it either pierces
that muscle or it runs underneath it. And when that muscle is too tight, it creates a traffic jam deep in the middle of your hip.
Okay. All right. So let's show you how to stretch the piriformis so that we can widen that highway so that nerve can send its signal down the leg. So Sarah, you're going to put this ankle on this knee. Okay. And I want you to put this hand up here. And you're going to push that knee away from you.
So I'm pushing that direction.
So we are pushing in that direction through her hand into her knee. So you want the knee to be able to come back towards where the other knee is. And Sarah's pretty tight right here. She lacks about 30 degrees of range of motion. So she's going to hold 30 seconds and she's going to work on deep breathing while she's doing this, in through her nose and out through her mouth. We're going to do 30 seconds 3 times. Okay, so we're going to push away, but we're also going to pull towards the opposite shoulder. So we can bring the knee across, and then she's going to grab behind that side, and this knee is really, we want this knee to come towards this shoulder. So we pushed it away from the shoulder on the first one, and now we're bringing it towards the opposite shoulder. This muscle rotates, and so we want to make sure that we get that oblique movement there. Again, she's going to work on breathing, and she's going to hold for 30 seconds and repeat 3 times.
And to give you an idea where I'm feeling it so that you can know that you're feeling it in the right place, I'm feeling it in that right buttock area.
Okay, so right here. Now we're going to show you a nerve glide. On these nerve glides, don't hold the glide because that's going to irritate the nerve. So Sarah, what you're going to do is pull your knee and hold behind it. We're going to lengthen the knee and bring the toe down towards your nose and then right back up and down. Good, so we start bent, straighten, toes towards the nose, and right back down. Notice that Sarah is not holding, she's flossing this nerve. If this hurts on the right leg, start on the left leg and just do the left side until you can do it on the side that bothers you. As this gets easier and you can do 10 of these without any problem, I can have Sarah bring her chin up when her toes are towards her nose and then right back down. If that causes Sarah too much pain, then when her toes come towards her, she can extend her neck and look over behind her. So show them that one, Sarah. So look back and then back up. Good. But to advance it, we can bring the chin up while the toes come down. Good. And we'll do that 20 times on each side. And that's going to increase blood flow by flossing that nerve, just like Sarah was saying earlier when you floss your teeth. Okay, so some of you wake up in the middle of the night and you can't go back to sleep because you got this pain running down your leg.
Big issue.
Yes. And over the years, I've used some techniques that help. One of them is doing that piriformis stretch and doing the nerve glide. But the other thing that really helps is ice, because it helps trick your brain. So you focus on that sensation of the ice, that cold for 20 minutes on your back, not on your leg where you feel the pain, but on your back in that lower lumbar area. And your body has to move that area that's getting cold back to your body temperature. So it wants to move it to homeostasis. So your body and your brain's going to send blood to that area. So when we increase blood, what do we do to pain? We decrease it. So if we can get more blood to that area of the low back, it's going to allow you about 45 minutes to fall back to sleep.
Yep. Other good thing about this is whenever they have sciatica, sometimes it's an inflammation, and it might be inflammation of lots of different things, but it could be bringing some of those white blood cells or helping that inflammatory process to decrease. That's another good reason why we could use ice. So,
and so if you have trouble falling asleep because you have restless leg and when you lay down, nerve pain seems to get worse, try ice, do the piriformis stretch, do the nerve glides, and then off to sleep.
And then I would say really quickly, but go back through our well chats. We'll chat
We'll chat for the core.
We'll chat for the core. we talked about using your transverse abdominis, and those exercises, remember, they're going to give you that corset around your spine, and we really need that to protect your spine and make it stronger. So we showed you stretches today and how to floss those nerves, but we still need to strengthen that area.
So go back and look at those core exercises, because those are really important for you guys that have the radiating pain down the legs.
And when we say radiating, it means it's going down. So referred, radiating, referred and radiating are differently. Radiating means it's going down the legs. Okay, so that's going to be really important that you know what that is. Okay, so we taught them today how to clear the highway, right?
Yeah, we have to get the cars out of the way so we can make it to our destination in the most quick time possible.
Efficient.
Yeah, the most efficient time possible.
And the least amount of pain.
Yeah, and with the least amount of pain, because we all know traffic stinks. So, in order to clear the pathway in your spine, you need to stretch and floss, and that's going to increase blood flow so that car can get through your hiney, because that's exactly what the sciatic nerve does. It moves right through the center of your hiney.
So it's super important, and this is a very common thing. I think that's why we use that at the first, because actually we had a patient come in the other day and had kind of self-diagnosed herself with sciatica, and so we were able to.
Sciatica.
It wasn't. We were able to help her kind of figure out why it wasn't sciatica, but through Google Doctor, she had self-diagnosed herself, and that's okay. So a lot of people do that. Hey, so long as you are getting some treatment for that area, it doesn't matter what you put a name on it sometimes. So,
and just remember, these are real general exercises. We are not diagnosing you. You need to go see your doctor
or physical
therapist if you are having symptoms that don't go away. But if you have general pain, these are great exercises to do to increase traffic flow in your hiney, because most of us walk around with a traffic jam.
Have a great day. Bye.